Welcome to our course about bloodborne pathogens. Read each statement, and then decide if it's true or false. It's okay if you don't know. We'll explain the correct answers. True or false? I could catch HIV from an infected person's spit. True or false? There is no cure for hepatitis B. True or false? A single exposure to blood or other potentially infectious materials could give me a life-threatening disease. After completing this course, you will be able to recall what bloodborne pathogens are, recognize symptoms and treatments for hepatitis B, hepatitis C, and the human immunodeficiency virus, identify how bloodborne pathogens are transmitted. Remember to assume that all blood and other potentially infectious materials, or OPIM, are contaminated and handle them accordingly. Recall safe handling procedures for blood and OPIM, and recall emergency procedures for blood or OPIM exposure. Bloodborne pathogens, or BBPs, are microorganisms that cause disease. They are transmitted through contact with contaminated blood or body fluids. The three BBPs that pose the greatest risk in your workplace are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV. What is viral hepatitis? Hepatitis is inflammation of the liver. It can be caused by exposure to distinct viruses. The two forms that pose the biggest threat in the workplace are hepatitis B and hepatitis C. The symptoms of hepatitis B and hepatitis C include flu-like symptoms, such as aches and fever. Hepatitis may cause jaundice, which is when your skin, mucous membranes, or the whites of your eyes turn yellow. Hepatitis can also cause weakness, lack of appetite, vomiting, stomach pain, and diarrhea. Moreover, hepatitis can lead to liver inflammation, liver disease, and liver cancer. These conditions can all cause death. The human immunodeficiency virus attacks the body's white blood cells. These blood cells play a major role in your body's immune system. That means your ability to fight disease and heal from injuries is impaired. HIV may eventually lead to acquired immunodeficiency syndrome, or AIDS, approximately 2 to 12 years after initial infection. Symptoms of HIV include swollen glands, chronic fatigue, yeast infections, night sweats, fever, diarrhea, and loss of appetite and weight. Although symptoms may not arise for many years, it's important to know that once you become infected with HIV, you can transmit it to others regardless of your physical well-being. You may be wondering, are there vaccines? A safe and effective vaccine is available to protect you against hepatitis B. Unfortunately, there is no vaccine currently available to protect you against hepatitis C virus. And despite current therapies that delay the progression of HIV, there is no vaccination available for the human immunodeficiency virus. You also need to know that there is no cure for hepatitis B, or HIV. And while new treatments for hepatitis C have shown improved cure rates for many patients, there's no guarantee of cure. Which three statements about symptoms and treatments for hepatitis B, hepatitis C, and human immunodeficiency virus are true? Bloodborne pathogens are transmitted through contact with infected blood or other potentially infectious materials, such as vaginal secretions or semen. Although there are various routes of entry, there are three common ways people are exposed at work. The first involves puncture wounds from sharp objects, commonly referred to as sharps. Blades, broken glass, and needles are examples of sharps. You can also be exposed to BBPs through broken or damaged skin, such as open cuts and skin abrasions. And you can be exposed to BBPs when they come in contact with your unprotected eyes, mouth, and mucous membranes. Even a small splash to the eye, a quick scratch to the nose, or a slight touch to the mouth can provide BBPs with a route into your body. Read each scenario and determine if the worker could have been exposed to a BBP based only on what you know about each situation. Matt uses the same hammer as someone who has HIV. Is he likely to be exposed to a BBP? Rob shakes hands with someone who has hepatitis B. Is he likely to be exposed to a BBP? Rosa uses her bare hands to bandage a skinned elbow for a coworker with hepatitis C. Is she likely to be exposed to a BBP? Read the question and then select the best answer. What is the one thing you should always assume about blood or OPIM? To handle blood or OPIM safely, you need to use the right personal hygiene, engineering controls, personal protective equipment or PPE, and good housekeeping practices. By following some simple personal hygiene procedures, you can reduce your exposure to BBPs. Cover all your open cuts and skin abrasions with a waterproof dressing to prevent contact with infectious material. This measure effectively eliminates one of the main routes of entry. In potential exposure areas, never eat, drink, store food, smoke, handle contact lenses, or apply cosmetics or lip balm. Wash your hands with soap and running water frequently. Doing so is one of the most important and easiest measures you can use to prevent BBP transmission. It's best to use soft, antibacterial soap if possible, because harsh, abrasive soaps can open fragile scabs and sores. Wash your hands immediately following any type of exposure. Remember, assume that all blood in OPIM is infectious. You also need to wash your hands after removing your gloves or other PPE. If you're working in an area without access to running water, then clean your hands with hand sanitizer or antiseptic towelettes immediately. Then be sure to wash your hands as soon as possible with soap and running water for at least 1 full minute. Engineering controls isolate or remove BBP hazards from the workplace and are the best ways to reduce your risk of exposure to blood and OPIM. So, what are some examples? One engineering control you might use is a sharps disposal container, in which you can dispose of sharp objects like needles or glass shards. These containers must be closable, puncture-resistant, leak-proof, labeled, and color-coded red or orange. You should dispose of contaminated items that are not sharp in biohazard bags or bins. For example, used gloves, paper towels, or gauze that have touched blood or OPIM all belong in biohazard containers. Other examples of engineering controls are self-sheathing needles and biological safety cabinets. You can wear personal protective equipment such as gloves, gowns, face shields, and eye protection to prevent transmitting BBPs. There are some things you should keep in mind. Anytime you're handling blood or OPIM, wear gloves. Many first aid kits contain these. Anytime there's a chance that blood or OPIM may splash, wear eye protection. Before using any PPE, check it for damage. If you find any tears, holes, punctures, or anything else that will diminish the PPE's effectiveness, take it out of service immediately. Make sure that your PPE is clean and fits properly. For example, make sure safety glasses are clear and don't slip, and gloves are snug, but not too tight. Properly remove equipment to avoid self-contamination. In other words, avoid touching areas of the PPE that may have been exposed to BBPs. Finally, place used PPE and other materials in the proper container. For example, used gloves should go in a biohazard bin or bag. Wearing gloves does not remove the risk of exposure to infectious blood and OPIM. They just help minimize the risk. Watch and remember where you put your gloved hands and make sure to clean and disinfect all contamination as soon as you can. While you wear gloves, don't touch your eyes, nose, or mouth. Don't forget to remove your gloves properly to avoid self-contamination. For example, when you remove your gloves, grasp the edge of one glove on the wrist. Pull the glove off, turning it inside out. Insert a finger into the opening of the other glove, avoiding contact with the outer surface of the glove. Pull the glove off, turning it inside out, and dispose of both the gloves into an approved waste container. You'll be rendering first aid to an employee who has cut herself with a blade. You expect arterial spray. Which of the following PPE can help protect your skin, eyes, mouth, and mucous membranes from bloodborne pathogen exposure? If you see blood or OPIM, don appropriate PPE and then clean them up immediately. Your employer may provide a spill kit or offer more specific guidelines regarding how to clean up blood or OPIM, but here are some general rules to follow. For surface spills, carefully cover the blood or OPIM with paper towels to reduce the chance of splashing. As soon as possible, soak contaminated equipment or paper towel covered surfaces in a 10% or 1 to 10 solution of bleach to water. Allow the solution to remain in place for at least 10 minutes to ensure that infectious pathogens are dead. Immediately dispose of or disinfect any cleaning supplies you used in the decontamination process in the proper containers. We'll talk about disposal momentarily. In medical environments, use autoclaves to sterilize equipment and to treat infectious waste. When you clean up and throw away blood, OPIM, medical waste, or sharp objects, you've got to plan ahead. Have the right cleanup tools as well as the correct disposal containers readily available. Place sharp objects like broken glass and pieces of metal in a sharps container. Remember that these are labeled and usually red or orange. Dispose of blood, OPIM, and medical waste in infectious waste or biohazard containers. These containers will be labeled and will also include the International Biohazard symbol. Never break, shear, bend, or recap a needle unless absolutely necessary. For example, if you have to help a person with diabetes with an insulin shot, dispose of the needle directly into a sharps container. Point it in first. Do not recap it. Clean up sharp objects using a disposal dustpan and broom, tongs, or forceps. Never put yourself at risk by picking up broken glass with your fingers. Once you've cleaned up, remember to decontaminate any areas or equipment exposed to blood or OPIM using a 10% bleach solution for at least 10 minutes. Read the scenario and then select the best answer. You're working as a dishwasher in a restaurant, and a customer drops a glass that shatters onto the floor. The customer's waiter cuts his hand while picking up the broken pieces and asks you to help with the cleanup. Since you're wearing rubber gloves, is it okay to pick up the pieces of glass with your hands? Yes. A coworker cut himself and dripped a small amount of blood on the floor. You need to assume it contains BBPs and clean it up. Choose the words that best complete the statements about the steps you need to take. If you think you may have been exposed to a BBP, don't panic. Immediately administer first aid by either thoroughly washing the wound or exposed area with running water and non-abrasive antibacterial soap, or flushing your eyes and mucous membranes with water or saline solution continuously for 15 minutes. Once you've done that, you need to alert and work with the appropriate personnel. For example, tell your supervisor. Then you should complete any appropriate exposure incident reports. There are various post-treatment options available to you. These include education and access to any additional disease-preventing measures to reduce or eliminate the effects of an occupational exposure to bloodborne pathogens, a hepatitis B vaccine or booster, HIV post-exposure treatment, blood testing, and counseling. Along with your medical records, all treatment provided by your employer should be confidential and protected. Read the question and then select the best answer. You grab a tool and notice a dried red substance on it. You suspect it may be blood. You have an open cut on your hand. What should you do first? You should now be able to recall what bloodborne pathogens are, recognize symptoms and treatments for hepatitis B, hepatitis C, and the human immunodeficiency virus. Identify how bloodborne pathogens are transmitted. Remember to assume that all blood and other potentially infectious materials are contaminated and handle them accordingly. Recall safe handling procedures for blood and OPIM, and recall emergency procedures for blood or OPIM exposure. Remember to assume all blood and body fluids are infected and take appropriate measures to protect yourself. Stay safe and stay healthy.